anyway, like Caterpillar, corporations saying, hey, we can't cover these people, and throwing them on the government's back.
Paul is very insightful. Exactly. That's exactly what's going to happen. Businesses and industries are going to do everything they can to figure out how to circumvent this, to get these employees off of their payroll as far as health benefits, and there's going to be a massive rush to the government system. I mean, we've seen that. We know for a fact that the competition. I mean, how can you compete with the federal government when you can set the price at whatever you want to? I mean,
and the government can lose money all at once. It's not a business. The government is the only business we know that can lose money every day and stay in business. Now, here's the thing that really bothers me. It's not a health care plan. I'm all for health care reform, but this is and was never a health care plan. There's no tort reform in it.
No, that's right. There's no tort reform. There's no portability. There's no allowing people to go across state lines to find the best deal. You know, I mean, the hits just keep on coming. But, you know, one of the things that we didn't talk about, even though we've touched on the business end and the loss of jobs and the government mandates, Rock, I am one of the strongest pro-life members in the United States Congress, and this is a major blow to the pro-life movement. It is the most pro-abortion piece of legislation in the last 30 years.
Yeah.
It just breaks my heart.
Yeah, it sure is. And here's Jim. Hey, Jim. Talk to Congressman Gresham Barrett. Go ahead, Jim.
Yeah, one comment earlier, you asked the question of the congressman about what other mandate has ever been done this way that force you to buy something. How about Medicare? I just turned 65. I didn't want it. You don't have a choice.
You don't have a choice? Hang on. You don't have a choice? You have to join Medicare? When did that happen? You do?
That's right.
I didn't know that.
And Jim, you're exactly right. Very, very insightful again.
Yeah, but that's a government health care program, and it doesn't.
Oh, it is.
By the way, they're the largest, the number one denier of medical care in the whole country.
Well, you know what's going to happen is, well, I mean, I tell you, you can track this back to the socialistic healthcare systems across this nation. Most of them in Europe. You know what's going to happen? There's going to be a rationing of health care. If you're an older American and you know you're not quite as healthy as you need to be, well, you know we might want to cut some costs. I don't know if you need that stent after all. I don't know if you need that heart surgery after all, because you know we do have to watch our costs here, and we need to spend it on somebody that's a little more healthy. I just think that it is such a dangerous path to go down, and it was a tremendous blow for freedom.
Here's Ed sent me an email, says, hey, Rocky, here's one Charlestonian who was happy about Obama's victory. See, that's how they look at it, Obama's victory on health care. It's great that millions of people will be covered, your friend Ed. He doesn't get it. They're not going to end up covered in the end. You're going to end up waiting in line and not getting any choice.
Absolutely. I mean, you know, it's.
If I thought it would work, I'd be for it.
We do have the best health care in the world. Now, again, do we need some reforms and some changes? Absolutely, but this is definitely going down the wrong path, Rock.
Hey, Donna, see if we can smash these two together. You know what I'm talking about? The two stop signs. I'm not micromanaging you, though. Barrett, I'm in trouble. I'm going to get killed. Barrett, I'm going to die.
Don't get Donna mad at you, my friend.
Oh, my God. She just stopped looking. When Donna stops doing what she's doing and looks just at you blank, you're dead. You know what? If her eyeballs had laser beams in them, I'd already have holes cut in my head. Yeah, here we go. Let's try it. I'll just see if we can do that. Just give me a yes or no. We'll be good.
Fixed it.
Did you? Stop looking at me like that. You make me wet my pants. Stop it. Here's John. Hey, John. Welcome to 1250 WTMA. What do you say, John?
What's up, Rocky?
Hey.
I want to say why I'm excited about this. I'm excited about this health care reform bill.
Okay, based on?
Based on the fact that it really exposes the Democratic Party for what they are. And it allows us to fight them at home instead of fighting them way off in the precincts where they like to hide and pretend like they're really for America and for Americans. So I think we've exposed them, and now we can take them out.
What do you hang on, John? Barrett, I said this when I was talking to Joe Wilson. I said this is the Democrats admitting out loud and in public who their core voter base is.
Yeah.
It's the lazy person who doesn't want. It's the lazy people. It's the folks who think that the government should, that other people, It's the person who thinks that other people are responsible for their health care and their well-being cradle to grave. This is all about taking away from producers and giving to non-producers.
Well, I mean, the president said it early on. You know, this is about the redistribution of wealth, and John's exactly right. They're showing their true colors. This is not health care reform. This is about controlling 1/6 of the national economy, and this is about controlling your life, telling you who and what you can do, what kind of service you can have, what kind of doctor you can have, and when you're going to have it. If that's freedom, then it's the wrong definition from freedom that I've read, Rock.
Jim has sent me an instant message to Rocky D 1250. Wants to know what can we do now, short of another civil war? What can we do now? What do you think, Barrett?
Well, we just got to keep fighting, Rock. Like I said, this thing is not over, and unfortunately, I think it's going to be played out in the courts. But, you know, this reconciliation bill has to go back to the Senate. And there's still a lot of changes. There's supposedly with unconstitutionality of some things like that. So it's just another chapter in the book. But I guarantee you that we the Republicans, have never been more united on a front to do everything we can to overturn this thing.
There's one more. Let's see. John. Oh, did I just talk to you, John? Hang on a minute. I'm missing somebody here. Oh. Line 2, go ahead. I didn't get your name, Line 2. Go ahead.
Well, my name is Lisa.
Hey, Lisa. Talk to Congressman Barrett. Go ahead.
Oh, well, actually, I actually want to ask you a question, but maybe the Congressman can answer it.
Sure. He knows more than I do because, as we know, I'm a talk show host, so everybody's smarter than me.
That's okay. Well, two things. I understand that Representative Clyburn has no existing opposition at this time declared.
Except in the primary.
Right, exactly. But I'm in again on the Republican side, and I also cannot determine by Googling who the opposition is that's declared to run against John Spratt in the 5th Congressional District. I live in Charleston, but I'm happy to give financial support to those opponents because I really want to see a clean sweep of South Carolina Dems out of our state.
Absolutely. The gentleman that's running against, or at least the one that says he's going to file against John Spratt, is Mick Mulvaney. And I would encourage, Rock, you know, you've got listeners throughout the state. I would encourage you to solicit somebody against Clyburn. I mean, these guys both voted for this health care, and it is overwhelmingly wrong, especially in South Carolina.
We had a little lady that ran against Clyburn a couple years back, and it just, you know, she got swamped. I mean, she got nowhere. I mean, let's face it. Clyburn's district is the most gerrymandered thing I've ever seen. It looks like a crab or something. You know what I mean? Like a kind you pull the legs off and eat at Crab Shack. I mean, basically, that district is drawn around racial lines, and I don't see why that's even allowed.
Well, it's, you know, if you remember, South Carolina's still under the VRA, the Voting Rights Act.
It's ridiculous. I mean, 29% of the people who live in South Carolina are black. 29%. I mean, there is no, I mean, that's not much of a minority. You know what I mean? I mean, they've got power here. They do. I always tell my friends from the North, Congressman, that, okay, you know, you talk about racism, blah, blah, blah. Look at you from New York and from Boston especially. And if you don't like black folks, don't move here. Because they're everywhere. You know, go move somewhere else. Go to Utah.
Well, it just goes, you know, the fact of the matter is there's a lot of Democrats out there that have supported this thing, that support big government, that support a government takeover of health care, that support a move towards socialistic issues, and I don't care who they are or where they are. We need to replace them with freedom-loving Americans that understand this is about the individual, not about the nanny state.
I just got a good instant message from somebody at Rocky D 1250 that said, you know, I made the statement that this is all about taking away from producers and giving to non-producers. Guess what? Many of the producers don't have anything to give either. So the Democrats have not answered where this is going to. How do you pay for this? There is a limited supply of money here.
That's right. And you know, we just spent, the Congress, at least on the House side, just spent $1.6 trillion, and we don't know where the money's coming from.
All right, Congressman Barrett, we'll let you go, man. Good luck.